Namaste Vidya. Hamisha Khush Raho Vidya. A very good morning to you all. Myself, JV and Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, and Faculty of Homeopathic Science at JAYOTI VIDYAPEETH Women's University, Jaipur. In this series of lectures, we are discussing about the diseases of the hepatobiliary system. In the last lecture, we have discussed about the liver failure. We have discussed about the acute liver failure, and we have also discussed about the chronic liver failure. Today, we are going to continue with the chronic liver failure, and today we are going to discuss about an important topic that is known as cirrhosis of liver. Cirrhosis of liver is one of the major causes that is leading to the development of chronic liver failure. In the chronic liver failure, I have discussed with you that we will be discussing the different factors like cirrhosis of liver, portal hypertension, and so on in the individual lectures. So today we are going to start with the cirrhosis of liver. What is cirrhosis of liver? What is the etiopathogenesis? What are the different clinical features? How to investigate the cirrhosis of liver and how to manage the cirrhosis of liver? All these things we are going to discuss in today's lecture. So let's start with the cirrhosis of liver. What is cirrhosis of liver? Cirrhosis of liver, it is a common disease. This is not very uncommon, and you are going to observe a lot of patients with cirrhosis of liver. So it is a common disease and it is characterized by two things. So in cirrhosis of liver, you are going to see two things in the liver. There will be hepatic fibrosis and the nodule formation. So first of all, we have to see for the hepatic fibrosis, and the second is the nodule formation. So whenever we are talking about cirrhosis of liver, you should remember two things in your mind: fibrosis, hepatic fibrosis, and the second one is the nodule formation. Now, what is cirrhosis? Cirrhosis is defined as the histopathologically as the development of liver fibrosis. So in the cirrhosis, it is characterized or it is defined histopathologically as the development of liver fibrosis. So you are going to see liver fibrosis to the point that there is architectural distortion. So much fibrosis is there in the liver that it is leading to the destruction of the architectural distortion with the formation of regenerative nodules. So not only the architecture is getting distorted, but the regenerative nodules are forming, which results into the decreased liver function. So what is happening due to the fibrosis? There is architectural distortion and there is formation of regenerative nodules, which ultimately leads into the decreased liver function. So what is happening? Ultimately, the liver function is getting disturbed or reduced. The most common cause of liver cirrhosis are the chronic villi hepatitis. So the most common cause of the cirrhosis of liver is basically chronic villi hepatitis and prolonged excessive alcohol consumption. So in case of liver cirrhosis, you are going to see for the chronic villi hepatitis, the most common cause is chronic villi hepatitis and the prolonged excessive alcohol consumption. So if a patient is taking a lot of alcohol, or if there is any kind of chronic villi hepatitis, both are responsible for the development of cirrhosis of liver. What are the different causes for development of cirrhosis of liver? Number one, we have alcoholism. If a patient is taking too much alcohol, then it can lead to the development of cirrhosis. Chronic viral hepatitis, especially with hepatitis B and C. So alcohol consumption, viral hepatitis with hepatitis B and C. We have cardiac cirrhosis. Next is the autoimmune hepatitis. Next, inherited metabolic liver diseases. Inherited metabolic liver disease consists of hematochromatosis, Wilson's disease, alpha-1 antitrypsin deficiency. Next, we have cystic fibrosis, non-alcoholic steatohepatitis, and biliary cirrhosis. So the most important causes of cirrhosis of liver are alcoholism, chronic viral hepatitis B and C. We have cardiac cirrhosis, autoimmune hepatitis. We have inherited metabolic liver disease, which includes hematochromatosis, Wilson's disease, alpha-1 antitrypsin deficiency. We have cystic fibrosis, non-alcoholic steatohepatitis, and biliary cirrhosis. Now, what is the pathophysiology that is involved in case of cirrhosis of liver? As I have discussed with you, in cirrhosis of liver, we are going to observe two things: hepatic fibrosis and the nodule formation. So both of these things will be discussed in the pathophysiology. So in the pathophysiology, the cardinal features of the cirrhosis. So what are the cardinal features of cirrhosis? it is an increase in the fibrous tissue. So there is increase in the fibrous tissue, and it is progressive and widespread death of the liver cells. So what you are going to observe in case of the liver cirrhosis, you are going to observe the features of cirrhosis with increase in the fibrous tissue, and there is progressive and widespread death of the liver cells. So you are going to observe fibrosis of the tissues, widespread, and death of the liver cells, progressive and widespread. So it is increasing, the death of the liver cells is increasing constantly, and there is a widespread death of the liver cells, and the inflammation leading to the loss of normal liver architecture. This we have discussed just now, that this will be leading to the disturbance of the normal liver architecture. And following the liver injury, so after this liver injury, there will be stellate cells in the space of the disease. These are activated by cytokinins, and these are produced by the Kupfur cells and hepatocytes. So following the liver injury, the stellate cells in the space of the disease are activated by the cytokinins, and these produced by the Kupfur cells and the hepatocytes. Now this transforms the stellate cells into the myofibroblast-like cells. So what is happening after this is, there is a liver injury, and after the liver injury, there are stellate cells in the space of the disease. These are activated by the cytokinins, and these are produced by the Kupfur cells and the hepatocytes. Now this transforms the stellate cells into myofibroblast-like cells, and these are capable of producing collagen, pro-inflammatory cytokinins, and other mediators, which promotes hepatocyte damage, and it causes the tissue fibrosis. So tissue fibrosis is called due to the transformation of the stellate cells into the myofibroblast-like cells, and these are capable of producing collagen, pro-inflammatory cytokinins, and other mediators, which promote the hepatocyte damage. The hepatocyte loss occurs, and with the increased collagen, there is production and deposition. So there is hepatocyte loss, there is loss of the liver cells with the increased collagen production and deposition, together with the continuing hepatocyte destruction. The liver contracts and shrinks. So because of the fibrosis, there is a shrinkage of the liver and destruction of the hepatocytes and shrinkage of the liver. The destruction of the liver architecture